Hi guys, so today we're going to talk about types of orgasms. In doing my research for the video, I found that a lot of times there's misconceptions and there's thoughts that there's like 10 different types of orgasms that you can achieve, but really there's only 2 real physiological types of orgasms that you can achieve. So the first one, the most common one, is the clitoral. And where the clitoris is where the 2 minor lips meet up on top is where the clitoris is. And it's covered by a little piece of skin called the clitoral hood. So if you stimulate that area, that's how you achieve a clitoral orgasm. The other type of orgasm is a vaginal orgasm, and this is where all the modifications come on. So this is where it is thought that we have the G-spot. The G-spot is not really medically proven to truly exist, but it's thought to be just an area that's like 2 centimeters inside the vagina, superior, like the front or the anterior wall of the vagina. So the way I can describe this is if you have your finger in the vagina, if you're touching towards your head, so the anterior wall of your vagina, and it's 2 centimeters in. That area of the vagina is thought to be very sensitive, and that's what people call the G-spot. If you stimulate that area, that's also another way to achieve an orgasm. If you stimulate your cervix or the posterior wall of the vagina, but technically these are all vaginal orgasms. Some women also achieve orgasm through anal intercourse. Some women achieve orgasm through stimulating their urethra, where we pee through, or just your oral skin, or mental orgasm. Some women can have an orgasm just by fantasizing. Some women also can have mixed orgasms, so being stimulated in multiple areas can make you have an orgasm that's considered like a mixed. And then also some women are capable of having multiple orgasms, where you can achieve an orgasm and then immediately after continue to have another one and another one. But everyone is different, so not all women are capable of having this type of orgasm. So female ejaculation is really thought to be just release of fluid from some glands around from where you pee or around your vagina. And some women have this release of fluid from the glands, and that's what people call female ejaculation, or it's also known as squirting. But sometimes it could also just be leaking of urine. So it could either be release of fluid in glands, or it can be urine. So other areas that are erogenous or pleasure areas are the lips, the breast, the nipples, and other areas that maybe not as much but also are considered erogenous, or maybe your back, your waist, also the inner arms, or even for some women their armpits, or any area where you might feel a little bit ticklish could be considered an area where there's erogenous sensation or pleasure area. So some women actually don't achieve orgasm. The reason why this happens is because sometimes, you're just not ready for it. Like, you might have personal issues, you might have issues in your relationship, your partner might have sexual issues like unable to maintain an erection, or something that can cause strain to the relationship. You might be stressed, thinking about other things, can't focus, can't concentrate. Sometimes it's difficult to achieve an orgasm after giving birth, or during pregnancy, or during menopause. Sometimes it's painful. There may be medical issues that you have that prevent you from having an orgasm, or medications that are causing you to not be able to have an orgasm. A lot of antidepressants give women this problem. And in some situations, it's just women are all different. So some women are different in how long they need to be stimulated or where they have to be stimulated. Some women just might have anatomical differences where you have to be stimulated in different areas than someone else. Some women have just anatomy that just, they found their pleasure areas by masturbation or by having sexual intercourse, and now they know how to achieve orgasms more easily than someone else. So to treat these problems, usually we recommend actually to masturbate and to find the erogenous areas in your body, or the pleasure areas in your body, and learn to find the areas that trigger an orgasm. Or you can do focused sexual exercises, we call them, with your partner, where you teach each other where to touch each other so that you can achieve an orgasm. And couples therapy, sexual therapy always helps. And some people even think that there's a collagen injection to the G-spot increases your chance of achieving an orgasm. So you can go see a doctor, a specialist, who would inject collagen collagen into your G-spot or the anterior wall of your vagina to make it more prominent or make it stick out so that it's easier for you to find it and have an orgasm. So I hope this helps you guys. Don't forget to like the video, subscribe to the channel, visit our Facebook page, leave me any comments down below, or email me at gynogal@gmail.com. See you next week. Is any type of pain that you can experience either before penetration, during penetration, or after. And it can happen to both men and women, but it mostly happens to women. Pain can be either in the outside part of the vagina,